gonna go to our first speaker, who's Sil Ganso with Our Bridge. You can introduce yourself and what you're gonna say, and then I'll put up the letter you want me to put up for everybody to read. Thank you.
Yeah, thank you, Hector. Thank you, everyone, for the time this afternoon to listen to each other and to, of course, Congresswoman Alma Adams. You have a huge fan here. I love you. I love what you do, and I just hope that every representative would have a little tiny bit of your determination, dedication, and empathy and love for our community. So thank you. I'm going to share a little bit of what we have been seeing and who we are, of course. Like Hector said, my name is Sil Ganso. I am founder and executive director of Our Bridge for Kids. I am thankful for the opportunity, and for those of you who are not very familiar with our work, we are a non-faith-based 501c3 working directly with refugee, immigrant, and asylum-seeking families. We offer after-school and summer programs to about 200 children in elementary and middle school, and who represent over 20 cultures from Southeast Asia, Africa, Middle East, Central and South America, Europe, Mexico, and the Caribbean. Our program and our curriculum are specifically designed for English language learners and focus on, of course, their English acquisition, social-emotional well-being, and cultural appreciation in a trauma-informed environment. Our beautiful community center is located on the Aldersgate campus on the east side of town. When Governor Cooper ordered schools to close on March 13th, we immediately reached out to each of our families to assess their most immediate needs and concerns. And we identified food insecurity as one of the biggest issues and one that we knew we could help with. With the help of strong and committed partnerships, we are now able to distribute 10,000 meals each week, including CMS breakfast and lunches, weekend groceries, and full dinners each night. So far, I'm very proud to share that we have distributed over 72,000 meals, Monday through Sunday, rain or shine, to hundreds of families. And as we all know, COVID-19 has highlighted the inequality and injustices our families have been enduring for years and years. Abusive employers, lack of health insurance, emotional distress, technological barriers, and limited access to resources and informational packages that were readily available in English but not translated into other languages. Those are just a few examples of what we have seen firsthand while we were present in the communities every day. At Our Bridge, we have spent thousands of dollars translating documents into Arabic, Amharic, Tigrinya, Burmese, Nepali, and Spanish, so that all of our families were aware of the basic information needed to keep them healthy. What are the signs and symptoms of COVID-19? How do we prevent the spread? Where to go if I need to be tested? As the world confronted a pandemic, our families were left out to figure out things on their own. The lack of effort to protect us is now manifested in the numbers. Our immigrant communities are testing at an incredibly higher positive rate than our American-born neighbors. And then it's a stimulus check coming from Washington that did not include millions of undocumented families, even though they have contributed billions to the economy each year. To end my time, I'd love to share with you the words of one of our immigrant neighbors. Hector, if you can pull up the letter, I'll read it in English. You have it? Great. Oh, I don't see it, but you see it. Hello, I am Veronica Perez. My family is composed of 4 children, my husband and me. COVID-19 affected us first by me losing my job. My husband is the only one still working, but his hours has been cut. He doesn't have the option of not going to work, even if he's afraid of getting infected, because he's now responsible to pay our rent and our bills. We lost our savings paying last month's rent. We are hopeful we were hopeful we would be able to receive the stimulus check from the government, since we have reported our taxes every year. Sadly, we did not get the check. We feel disappointed because we were not taken into account, even though we all know the virus is affecting everyone, and COVID-19 does not discriminate against race or immigration status. We are thankful for our bridge and for everyone who has given us help, for bringing us food and keeping us informed about the pandemic. Thank you for listening to our situation. We are hopeful and we have trust in God that this will be over soon. Like I said before, this is just one example of what our families are going through. And another point that I'd love to make really, really quick is we know families have a lot more to say, but there's not trust built between government and communities for them to be able to express what they want to say. In our case, we know that families are not completing the census, families are not giving information, families are not asking for help, they don't even want to go to a doctor, and that really has to change. And I think that we need to start working on that right now. So thank you so much for the time. I'll be here if you guys have any questions.
Thank you, Sil, for everything you're saying, everything you said. We're going to move on now to Dr. Hutchings, representing Novant Health.
Good afternoon. Thank you, Hector. I want to thank you for the opportunity to be here. Congresswoman Adams, I greatly appreciate all that you do for your constituents. You have been an ally for healthcare throughout your time, and we are just most appreciative of what you continue to do for all of your constituents. So on behalf of Novant Health, thank you.
And thank you.
Novant Health existe para mejorar la salud de nuestras comunidades, una persona a la vez. Creemos que Novant Health puede mejorar no solo la salud de cada individuo, sino también la salud de comunidades enteras. Involucrar a nuestras comunidades y honorar la diversidad es fundamental para quienes somos en Novant Health. Nuestro objetivo final en la participación comunitaria es la equidad en salud, es decir, mejorar la salud y la movilidad ascendente en todas las comunidades, especialmente en aquellos que más que lo necesitan. El primer paso en este trabajo es enfrentar las desigualdades estructurales y los prejuicios basados en la raza, el origen étnico y otros dominios. Estos producen desventajas sistémicas que afectan los determinantes sociales de salud: acceso a alimentos, vivienda, atención médica, estabilidad económica y otras oportunidades, lo que a su vez genera disparidades en la salud. Hemos practicado community engagement durante muchos años y de muchas maneras, siempre con el objetivo de lograr la equidad en salud. Por ejemplo, estamos alineando esfuerzos innovadores para aumentar el acceso a la atención. La semana pasada nos asociamos con la Coalición Latinoamérica para distribuir la educación COVID-19 en español y 2.300 máscaras de tela gratis para los miembros de la comunidad. Segundo, honoramos la voz de los miembros de nuestra comunidad y los obstáculos y activos únicos que cada comunidad presenta. Proporcionamos inmunizaciones gratuitas y conexiones de necesidades sociales para más que 11,000 niños en el crucero Novant Health Community Care cada año. 70% de estos niños son hispanos y latinos. Novant Health entiende que abordar los determinantes sociales de salud en la comunidad hispana y latina es fundamental para promover la salud y la equidad en salud. Novant tiene un departamento dedicado a la participación comunitaria con una visión de equidad y en salud, enfoque estratégico en los determinantes sociales de salud. Somos intencionales y deliberados en nuestro trabajo. Si ustedes tienen preguntas o para obtener más información sobre nuestras iniciativas de participación comunitaria, Comuníquese con communityengagement@novonthealth.org. Muchísimas gracias por el tiempo y otra vez, thank you, Congressman Adams. We greatly appreciate once again your time, your diligence, and your patience to our community and to healthcare.
Thank you.
Thank you, Dr. Hutchings. Now we're moving forward to Banu and the Charlotte Bilingual Bilingual School.
Thank you. And thank you, Congresswoman Adams, for your advocacy and for creating policies that build a bright future for everybody in our community. We really appreciate your service and your kinship. It is amazing to be heard and to know that we have a voice at the national level that represents our needs. So we appreciate the time to talk. As you know, my name is Banu Valladares, and I'm the proud executive director of Charlotte Bilingual Preschool, where we prepare Spanish-speaking children for success in school and life by providing them with a superior dual language education in strong support of their families. Like Sil mentioned, our work has drastically shifted because of COVID, and we are also in the business of providing food and resources for families. So when a pandemic of this size impacts us, those who are down tend to be kicked hardest. So we know that our community has been disproportionately impacted by the pandemic, where half of our families have lost jobs and 74% of them don't have health insurance. And they're unable to access resources because of fear of retaliation or because of a system that just continues to overlook the complexities of what it's like to be an immigrant in the United States. And it's a little bit more complex than a one-size-fits-all. So we desperately need laws and policies that address the needs of the whole family, immigration reform being one of those things. And I brought with me, without taking too much airtime, 3 of our wonderful families that really represent us really well, who can talk about the impact of COVID on their families. 2 of them I will be translating for. Daniela, you go first.
Ok, buenas tardes, mi nombre es Daniela López. Les quiero compartir un poco de mi experiencia personal, cómo nos ha afectado la pandemia del COVID-19.
I want to share some of my personal experience of how the pandemic of COVID-19 has impacted me.
Ok, como familia latina migrante, pues mi esposo y sus hermanos tienen un pequeño negocio.
As an immigrant family, a small immigrant family, my husband has a small business.
Y entonces, pues, debido a la pandemia, pues el trabajo bajó demasiado y pues se vieron obligados a recortar muchos empleados.
Due to the pandemic, his work was drastically reduced and they had to let go of employees.
Y pues cuando ellos trataron de buscar o asesorarse y buscar sobre los fondos o ayuda que el gobierno estaba dando, pues lamentablemente les dijeron de que ellos no aplicaban para las ayudas por no tener un estatus legal.
And unfortunately, when they were looking for federal aid that was being distributed to other people, they did not qualify because of the status, the legal status.
Entonces, pues esto es una de mi experiencia que pues como inmigrantes nos toca vivir por no tener un estatus y pues muchas gracias por la oportunidad que nos dan de compartir.
This is one of the experiences that we have to live as immigrants here, and thank you for the opportunity to share. Gracias, Daniela.
De nada.
Sandra, I'm going to also translate for her. I think she felt more comfortable if I did that. Though she's perfectly fluent.
Okay. Thank you. Buenas tardes, mi nombre es Sandra Mendoza y de igual forma también el trabajo ha sido afectado.
For us, equally, work has been impacted.
Mi esposo estaba trabajando por casi un año donde estaba regularmente. Al principio de la pandemia le cortaron totalmente las horas
He was working regularly for about a year, and when the beginning of the pandemic started, they started cutting his hours.
Empezó a buscar con amigos y familiares otro trabajo.
He started looking
Consiguió
for
otro.
additional work with families and friends. He found another job.
De ahí trabajó como por 2-3 semanas. Igualmente también ese trabajo se acabó.
He worked there for 2 to 3 weeks, and unfortunately that job also stopped.
Desafortunadamente en ese mismo lugar no le pagaron 2 semanas que estuvo trabajando. Tuvo que buscar en otro lado.
He was not paid for the 2 weeks that he worked there, and he had to look someplace else.
Ahorita está en otro trabajo y pues este es el tercer trabajo durante este proceso de pandemia que ha tenido él.
This is his third job that he's had to go through and during the pandemic.
Y pues de la misma forma, los ahorros han ido ahí.
Equally, our savings have disappeared.
Bueno, muchas gracias por escucharnos y darnos la oportunidad de hablar.
And thank you for listening to us and the opportunity to talk. Gracias, Sandra.
Gracias.
Osmara.
Buenas tardes a todos. Good afternoon, everyone. Just something fast for me to share with everyone. I was telling Principal Vanu that as a immigrant family, at the beginning, where I think everyone just about lost their jobs. Thankfully, my husband still is working. My father's still working, but it's limited. The income's limited. Is gone down just about above half of what used to come in. They're exposed to the virus on a daily basis. We don't have health insurance. We don't qualify for health insurance. And, just the fear of going to work every day to provide just enough to survive every day with kids, small kids, trying to, avoid trying to stress the kids out with our stress and just cope with everyday life as the immigrant family here.
Thank you. And I just want to make a point that when we're talking about losing salaries, we're speaking of beginning salaries of about $40,000 for a family of 4. So this is just context for what it really means, how our families really, when you lose your job and you have little, it is that much more stressful. And to not have supportive systems that actually can help them thrive completely negatively impact the success of their children. So thank you for looking for solutions for us and for giving our families a voice, an opportunity to be heard.
Thank you, Vanu, and volunteers from Bilingual Preschool. Your stories were amazing and really powerful. So we're going to move on now to María José from Comunidad Colectiva and the amazing work they've been doing. And yes, so thank you, María José.
Hi, Congresswoman Adams. Just wanting to echo again, thanks for having this conversation with us today. I just wanted to share a little bit of what our experience has been working with folks on the ground. And so some of what we have been doing has been trying to really push out educational information to folks regarding COVID tactics, how to protect yourself from wage theft and things like that in Spanish. I think that one of the biggest challenges is that several weeks ago, we had several folks reach out to us that had lost their job, and due to their documentation status, were afraid, had lost their job and actually not been paid, and so were afraid to take any sort of action in order to get those wages back. And so those folks ended up getting their money. And so I think that that's just an example of, a lot of the insecurity that folks are facing in this moment. In addition, we have been partnering with a coalition of other organizations statewide in order to be able to provide some undocumented families across the state with relief. And so, as you know, and as has been mentioned, during this conversation today, undocumented folks are not able to receive any sort of government assistance. And so what we have been doing is partnering in order to fund folks checks of the amount of $1,200. And so we were actually able to fund over 25 families here in the Charlotte area just this past week through that coalition that we're participating in. Obviously, just 25 families is not very much in the grand scheme of things, and folks are still very much in need. We were able to talk to some folks that have been out of work for 3 months, and so the 1,200 kind of seems like a Band-Aid in this moment, but definitely folks are expressing gratitude and a lot of uncertainty, right? A lot of undocumented folks have lost their jobs and are not certain if it'll be safe for them to go back to work, not only due to worries about COVID, but also because they're not sure what it will be like for folks that have no documentation status after COVID. And so I think that it's really important to kind of keep these things in mind. Something else that we have heard is that folks are afraid of the cost of medical attention should they need medical attention, right? A lot of folks that are undocumented are not eligible for healthcare. And so it's another battle, right? When you're concerned about making ends meet to begin with, and then you're not sure if you'll be able to pay bills should you fall sick or someone in your family fall sick. And so I think that this is just generally some of the stuff that we've been hearing on the ground. Again, we're super excited to have been able to provide those funds to families and hope to continue to have several more funding cycles, funding permitting for that, and are looking to fund more families, of course, in the Charlotte area. But I think that that's been really one of the main ways that we've been trying to plug in and support the community during this time. And again, thank you so much for listening. We hope to continue, like I mentioned, to fund folks and to be in sharing more information in Spanish through our Facebook and through other channels such as this. And thank you so much for listening to us today.
Yeah, thank you, Maria Jose. And thank you for Comunidad Colectiva for the really amazing work you're doing in the community. Thank you. So I'm going to be talking a little bit about some of the asks that we have, and I'll make it brief so that we can move on to the next part of the agenda. As I mentioned at the beginning, and that's been evidenced throughout the conversations everybody's been having, there are certain things that we're needing for our communities. And so right now, first off, once again, thank you for the HEROES Act. Thank you for everything you're doing to move it forward and including immigrants. Here's some things that that we've been thinking about in terms of the HEROES Act. The things that we're happy about, with healthcare, the COVID-19 testing, treatments, eventual vaccines, and so on. The cash payments that is expanding to include more people who have individual tax ID numbers. We're loving the fact that it's including people with extended authorization for the same time period and other immigrant protections. We're happy about the remote oath ceremonies and the hazard pay for essential workers. These are people who definitely need it, who are on the front lines, not just medical providers, but people who are working in supermarkets and other places, helping us get the things that we need. Higher education, the forgiveness around tuition and so on. Those are things that people in our community really, really need. We're also thankful with the hygiene and the communication, being able to help people with detention to get the needed access to free phone calls and hygiene products, and release ICE. So around ICE, having review files of everyone in detention. These are things that we're thankful for, and the money that's going to different states, expansion of the Federal Reserve. But there are a few things that we would like to see improved in future legislation, and hopefully we can get the Senate to do the same. We need improvements on the public charge, because right now it doesn't include a suspension on the public charge rule. We need the public charge rule to be suspended, because this is an attack on lawfully present people and telling them that they're going to lose their green card, their resident status, and be subject to deportation. We need that to be changed. We need suspension or limits on ICE raids, because right now is not a time to be filling up the jails. Right now is not a time to be putting more people in danger in a jail where they could be contracting COVID-19. But not just that, families do not need to be torn apart. And it isn't about need. Families should not be torn apart. We need people in ICE detention to be released. ICE needs to be reviewing their files to see who can be released, and in order to have more families together. But also, fewer people contracting the COVID-19 virus. These are some of the things that we absolutely need. So these are the things that we need for the immigrant population, but we also would like to see more ways we can be working with our members of Congress in order to stop the police violence in our community, because it's hurting Black and brown communities. For example, 2 years ago, Ruben Galindo was murdered by a police officer when Ruben was still on the phone with the dispatch. When he called, and he was still on the phone with dispatch, he had a phone in his hand, and he was shot dead. And then this past weekend, we have George Floyd and Breonna Taylor right before that. And then with all the raids, and all the protests have been happening, the police misconduct, attacking the people in our community, as it was evidenced this past Tuesday. And the fact that I was there on Saturday when the police was kettling or otherwise boxing people in order to bomb them with gas. So we need to be seeing social justice for all of our communities of color, immigrants, as well as other communities like the Black community. So I'm gonna end it right there, because right now we want to give an opportunity for the Congresswoman to speak again about the amazing work she's been doing, and to see if she has any responses to the things that we've brought up on this call today. Okay, Congresswoman.
All right. Thank you, Hector, very much, and I want to thank all of you for sharing your stories, your personal, heart-wrenching examples of what many people are experiencing within our community. Hector, you ended up by talking about what happened in the community, and I don't know if you are aware that I did release a statement that spoke to that whole issue of these chemicals. I think that's absolutely atrocious what happened, and I'm certainly very much opposed to that, and we need to ban that right now. But let me just thank all of you for sharing those stories. I think it's important for us as we come together to hear what other folks are going through. I believe that every human being deserves to live a life of dignity and to receive the support, particularly during this difficult time. And I want you to know that I see you, that my colleagues in Congress sees you as well. Many of the issues that you have discussed are ones that we tried to address in the most recent bill, the HEROES Act. I agree with you. I thought it was very disheartening not to have some of the things in the previous legislation that we passed, but we're trying to make it right. Now, this $3 trillion corona relief package aims to address the millions of people that were left out of previous bills, including undocumented immigrants who have been on the front lines and who are critical to our response to the pandemic. Now, Hector, you mentioned something about workers and essential workers, and many of those essential workers come from your communities. I do sit on education and labor, and I chair the workforce protections committee, and we are addressing that issue right now. I have a bill that I'm sponsoring with Congressman Scott and Congresswoman Shalala to look at making sure that if we think people are essential, and I know that they are, they need to have essential protections. But anyway, the HEROES Act would also issue stimulus checks to undocumented immigrants with the ITIN number, mixed status households and their families. It would all become, they would all become eligible for the first round of stimulus checks, as well as a proposed second round, which would amount to up to $1,200 for each tax filer and each of their dependents, depending on the income of that household. Now, we know that an estimated 16.7 million people live in mixed status households nationwide, including 8.2 million US-born or naturalized citizens. And so these stimulus checks are needed to help families put food on the table and to cover critical expenses. The bill would also require U.S. Immigration and Customs Enforcement to review all the files of detained immigrants and release all of those who aren't subject to mandatory detention and who don't pose a risk to public safety or national security. It would also require new standards for those who are currently in detention. Detainees would have to be provided with free and unlimited soap, as well as phone, video calls, so that they can communicate with their family members and attorneys who are not allowed to visit most of these centers in person during this pandemic. The agency also has been releasing detainees who are medically vulnerable to COVID-19, but there's still almost 30,000 immigrants in detention across more than 130 private and state-run detention facilities nationwide. As of May 14th, 943 have detainees that tested positive for this virus. So Americans have relied on low-wage workers, many of whom are undocumented, to keep essential services running during the pandemic, from harvesting to delivering our food to cleaning public spaces. And that's why I mentioned essential workers, because this bill would shield them from deportation. It would offer employment authorization during this pandemic, and employers in critical industries would not be penalized for hiring undocumented immigrants. Undocumented immigrants make up to about 25% of farm workers, 8% of the service sector, and production workers. So DHS would also be compelled to maintain protections for DACA, TPS recipients for the duration of this period initially granted by the department. Now, I want to talk a minute about visas, because hospitals across this country are facing staff shortages. And we know that the U.S. health system relies heavily on immigrants, who make up 17% of all healthcare workers, more than 5% of our doctors. And so the bill would speed up the processing of visas, green cards for medical professionals. And so anyone seeking to practice medicine, to conduct medical research, or to pursue education or training to combat COVID could be approved for a visa on an expedited basis. And so once they're approved for this visa or green card, medical professionals would have more flexibility to go where they're needed under the bill. So those H-1B visas for skilled workers would be able to transfer to other hospital systems and offer telemedicine services without having to apply for a new visa under the bill. I think we have to make things less complicated. So medical students will also be able to transfer their rotations within their host institution and may be compensated for their work during the pandemic. Access to health care, regardless of status or insurance. Last but not least, this bill would allow undocumented immigrants without health care coverage to qualify for no-cost testing, treatment, and vaccines related to this coronavirus. U.S. Citizenship and Immigration Services has announced that it won't consider the use of free testing services when evaluating whether immigrants will likely end up relying on public benefits under the public charge rule, which went into effect in February. So the agency also said that it won't weigh COVID-19 treatment or preventative care, such as a vaccine, if it is eventually developed under the rule, even if those services are covered under Medicaid. So in summary, this ambitious bill, and it is ambitious, would protect undocumented immigrants who are working in essential fields from deportation, and it would make them eligible for federal stimulus funds as well. The bill clears the way for more foreign healthcare professionals to help fight coronavirus in the United States, and it would deliver necessary health care benefits to immigrants who are eligible for Medicaid. And last but not least, it would require immigration authorities to release people from immigration detention where possible. And while this bill makes significant strides toward closing the gap in relief for immigrant communities throughout during this pandemic, it does leave a gap for refugees at a time when resettlement efforts have come to a standstill, and refugees who have recently arrived in the U.S. aren't eligible for federal stimulus checks. That's an area that we must address, not only in COVID-19 relief packages, but as a part of our overall agenda, an overall agenda for humanity. In the meantime, we need Mitch McConnell to pass the HEROES Act right now. There are lots of heroes and communities and family heroes in our families that need that support. And that's the best way you can get that done. And we need the help from everyone on this call and those who are not on it. But we need to call, you need to email your senators, Burr and Tillis. They each represent North Carolina. And at the same time, I will continue to fight for solutions that will help us recover from the devastating impacts of COVID-19 and help everyone in our communities to weather this incredibly difficult storm. And I want to say again, thanks to Hector and Action NC for organizing this meeting. And thanks to all of you for being here. And with that, I'm happy to take a few questions. I have two of my staff members on as well who may be able to assist in this process. So Hector, back to you.
Hello, everybody. Thank you.